Welcome to the panelists for panel 11. Panel 11 is titled Securitization of COVID-19 Health Protocols, Policing the Vulnerable, Infringing Their Rights. And this panel is brought to you by Harm Reduction International. And so without further ado, let me pass the floor to Ms. Giada Girelli. I hope I say it correctly. Certainly you will introduce the panelists far better than me. So let me pass the floor over to you as the moderator, please.
Thank you, Robin. And you said my name perfectly, which is not always the case. So thank you so much for that. So again, good morning, good afternoon. Thank you all for joining and welcome to this panel on the securitization of COVID-19 health protocols in Asian countries. My name is Giada Girelli. I'm a human rights analyst at Harm Reduction International, and I'll be your moderator for the next 90 minutes or so. So most of us are very familiar with online discussions. Most of us have been here for the whole day, but I'll just quickly go through a few housekeeping notes while more people join. Just a reminder that this session is recorded. It's also been live streamed on the Facebook page of the Asia Center, and it will later be uploaded for further dissemination. So if any of you have issues or concerns about your video, your face, your name being shown, just be please aware of that. I'd also be very grateful if you could ensure that your mic is muted throughout the session. If for any reason you need to intervene, please just post a comment on the chat or use the raise hand function and we will give you the floor. Finally, we have discussions, we have presentations, but we really want this to be an interactive conversation. We have participants from many countries in Asia and we really value your expertise. So we encourage you to post as many comments in the chat and as many questions in the Q&A boxes as possible. There will be a Q&A session after all the speakers have intervened, and we will address as many questions as possible there. Now, to provide some background to this panel, Harm Reduction International is an NGO working to reduce the negative health, social, and legal impacts of drug use and drug policy. Working in this drug control space, we have long been addressing the use of criminalization and of penal laws to confront public health issues, the centering of security actors and narratives into public health spaces, and its negative repercussions on human rights and public health. We have long been reporting on and advocating around the consequences, more or less intended, of these punitive approaches on individual and public health, and on how these approaches actually further marginalize and discriminate against, rather than empowering and supporting vulnerable communities. Since the start of the pandemic in early 2020, we witnessed a war on COVID being launched in many states, including in Asia, and I know the panel just before us addressed this metaphor really in depth. These wars are really not exceptional or new. On the contrary, they can be understood as part of this broader trend I just mentioned towards the encroachment of law enforcement in health spaces. And this is coupled with ongoing attacks on democracy and moves towards authoritarianism that we've been witnessing in many countries. As these securitized strategies are not new, the good news is that we can build on what we know about other wars, particularly the war on drugs, to assess how ineffective these policies are in addressing health emergencies, while being unfortunately dangerously effective in centralizing powers in the hands of the executive and in deepening marginalization, inequalities, and social control. We can also build on what we know that works when addressing other health issues to recommend more effective, more humane, and more human rights-centered strategies. So this panel is dedicated precisely to discussing key trends that we witnessed in South and Southeast Asian countries concerning national COVID-19 responses, with a focus on the use and misuse of emergency and executive powers, the involvement of police and the military in the response and ensuing human rights violations and abuses, and the use of fake news, misinformation, surveillance to sort of quash opposition and activism. To do so, we will also build on the findings of a report recently published by the Asia Center in collaboration with HRI, which either is or will be posted briefly in the chat. We will start with the regional overview on the issues of militarization, misuse of executive powers, abuse of fake news and misinformation laws, and expansion of surveillance in the context of the COVID-19 response. And I'm really honored to have two amazing experts to give us an overview of these trends. Dr. James Gomez, Regional Director at the Asia Center, and Dhevy Sivaprakasam, Asia Pacific Policy Council at AccessNow. After that, we will move to an in-depth analysis of country situations with a focus on Indonesia, Malaysia, and the Philippines. And again, I'm really honored to have on the panel Irma Hidayana, co-founder and co-leader of Lapor COVID-19 in Indonesia, Dr. Hartini Zainudin, among other things, co-founder of Yayasan Chokit and child rights activist in Malaysia, and Dr. Josh San Pedro, co-convener of the Coalition for People's Rights to Health in the Philippines. So one more thank to all the speakers, to the attendees, and in particular thanks to the Asia Center for hosting this panel. And I'd say now we can give the floor to our first panelist. Dr. James Gomez is a regional director at the Asia Center, where he oversees its operations in both Thailand and Malaysia. He has over 25 years of experience in leadership roles at universities, think tanks, intergovernmental agencies, and NGOs. As I was saying, he's also the co-author of the recently published report on the securitization of COVID-19 health protocols, and he'll walk us through the key findings of this report now. So James, the floor is yours.
Thank you, Giada, very much. Asia Center is very happy to work with harm reduction. I'm here essentially to very briefly walk through the key parameters of the report, providing the frame for all the other speakers in the panel to dip in and expand on this specific area. Even before the report was fully published, we were able to come up with a briefing note, and we also used the opportunity to engage with the parliamentarian network called Unite that deals with issues related to infectious disease and ending the pandemic. So with that, this report covers 5 countries: Indonesia, Malaysia, Philippines, Singapore, and Sri Lanka. And these is the content of the report. The report cover is there right now. You will be receiving the link in the chat room for you to both, download the policy paper, the precursor to the report, as well as this report. I think the key thing, and moving on to the next slide, is really the securitization of the COVID-19 health responses. The report, as it opens, highlights 3 key approaches. One is a very highly militarized approach, where the military provides overall leadership and direction for health protocol implementation. Then you have the securitized approach, where the police lead the daily operations of COVID-19 health protocol implementation. And last but not least, the blended civil approach, where health experts and elected officials direct health protocol implementation. They may also use civilian officers and representative to do monitoring, as well as social distancing and compliance with mask wearing and other things. Now, this is how the security forces, operate. Essentially, they coordinate and the assignment of all health protocol. Usually, this is done through a committee, either under a ministry or under the Prime Minister's office at the highest level, that directs, the different units within the country to deal with implementing the health protocols. A key thing is people movement, because the infection was deemed to be contained. And so in the early stages, most countries were going for 0 infections. So going in and out of the country, airports were closed. There were constant shifting, travel and health advisories, and the airlines, air travel and other things we brought down. Now, within the country, there was also interstate checkpoints and roadblocks, especially for large countries. So here the military and the police played a key role. And if we dive down to the local neighborhood, then you have, community patrols, kind of a self-policing. it varies from community to community, and the idea of collectivism. So that was another approach. And finally, the role of the security forces in establishing quarantine facilities in areas beyond the hospital, whether it's field hospitals, whether it's in military barracks or stadiums, so on and so forth. So this is where the key function was of the security forces. Now, before I go on to the next element, which is the surveillance and privacy of individuals, all of this was made possible through the use of COVID-19 laws. Now, there were two approaches: either the utilization of standing emergency decrees, or in many cases, countries, rolled out new COVID or public health policy laws. So although Thailand is not covered in the study, but I can share with you what's going on right now in Thailand. Thailand has been using the emergency decree, and it has been sort of renewing it regularly since the start of the pandemic. Now, what it's doing now is it's going to try to institutionalize some of the mechanisms that it put up under the emergency law. So it's now going to roll out a public health law to deal with public health crises moving forward, because the thinking is it needs to prepare long term and put into place mechanisms to deal with crises like that. So this is just to give you a flavor. Now, under these approaches, you had surveillance and privacy. In particular, the use of technology, the apps, the report, discusses the methodology, the apps, the process, the behind the scenes of the different developments in each of the 5 countries. But essentially, it has been primarily used for contact tracing. It was leveraged on existing national digital infrastructure where it was available. A lot of it was in countries like Singapore and others that have a higher digital footprint. It kind of grafted on it or drew from the existing surveillance mechanism. In countries where there was less internet infrastructure, less internet surveillance, such as Sri Lanka, then there was a more sort of traditional people-based, contact tracing. But the key issue here is really over data and privacy breaches, because as the states collect the data, they also share it within the ministries and at times been used to persecute or prosecute individuals along political lines, especially when they called out the mismanagement of sitting regimes in the way they handled the crisis. But as we examine the situation, a key fallout was felt by vulnerable communities because they became the most policed constituents of the health protocols. So across the 5 countries, we had, extreme policing of migrant workers, garment and textile workers, because garment and textile workers, worked in very, very crowded and thick workplaces. So they had to be policed in order to ensure there was no spread of infection. And again, one has to keep in mind, these were the early days where countries were going for zero infections. Refugees were denied access to the countries or became target groups. That were surveilled even more and policed even more. And the fact that they lack citizenship rights and access to health facilities made them even more vulnerable. Now, women and girls were also severely affected, especially they became vulnerable to human trafficking because of the need for income, as a lot of jobs were lost and the informal economy suffered tremendously. There was also greater exposure to domestic violence. And for vulnerable groups that were living in the periphery, there was also issues of lack of sanitation and healthcare facilities. Frontline workers, medical workers in particular, were put up to significant pressures. Some of the countries that we surveyed in the report didn't get their vaccine process in order in the early stages of the day, but yet the frontline workers had to deal with the pandemic, and they had lack of protective equipment and other things, and because they were so exposed in helping others, they also suffered discrimination and stigmatization. And not just in these 5 countries, but across the globe, we find medical workers in the front line suffer from these sorts of discrimination. And finally, ethnic minorities. Again, we are looking at periphery territories, in the margins of the countries, in the highlands, where they don't have access to internet and also access to quarantine facilities and treatment. So they had less than adequate, protection and medical facilities in relation to the pandemic. So there were 2 things that we broadly recommended, and in the interest of time, I will just keep it to the main point. One, we call for the de-securitization of the health protocol, and I think part of this will happen simply because we have moved beyond fighting the war of COVID-19 and to sort of moving to vaccination and an endemic situation. It remains to be seen, but it's still securitization is one of the key calls of the report. And secondly is to increase the support for vulnerable communities and to recognize vulnerable communities need equal attention, because many governments, prioritize citizens and do not take into account their duties to all people under their care. And vulnerable communities in particular, were deprived of this care. So these were the 2 principal recommendations, and I'm sure the colleagues in the panel will flesh it out. On that note, I say thank you on behalf of Asia Center and Harm Reduction. It is our pleasure and our duty to share the spotlight on this very, very important topic and part of the pandemic that needs further attention. Thank you.
Thank you so much, James, for condensing such a dense and rich report in 8 minutes. That was really useful. I just want to highlight, as you mentioned, that the pandemic and the emergency and public health laws that were introduced really allowed the expansion of very invasive measures, both online and offline. What we also saw in the report is that there was very little monitoring and oversight. There also was very little civil society involvement and engagement. I just want to mention, because you talked about rightly vulnerable communities, that another sort of key topic of the report, and something that the report shows very well, is how these invasive measures are not problematic only from a human rights standpoint, but actually from a public health standpoint as well. So they're really not only abusive, but actually very ineffective to control the spread of a virus such as COVID-19. And that's also because such invasive measures and the involvement of law enforcement pushes vulnerable communities to the margins and pushes them to disengage with authorities and maybe to try and avoid public health regulations rather than really buy them in and be supported to sort of to follow them and to comply with them. I also wanted to thank you for highlighting how medical workers and frontline workers have sort of become vulnerable communities. I think this is something that Irma and Josh will also touch upon later. And finally, thanks for highlighting the example of Thailand, because I think when it comes to emergency powers and the pandemic, one of the main concerns that we have as civil society is that these measures that have been introduced as short-term and very targeted will actually overstay the pandemic, and that will have medium and long-term effects that we cannot really, be sure about, but we're really concerned about. And it's something that I think our next speaker will also address. So I now pass the floor to Dhevy Sivaprakasam, Asia Pacific Policy Council at AccessNow, which is an NGO dedicated to defending and extending the digital rights of users at risk around the world. Dhevy previously worked at the International Commission of Jurists, among other things, where she led thematic work on technology and human rights, focusing on freedom of expression and information online. Dhevy will address the introduction and the use of fake news or misinformation laws and similar initiatives that have been abused in the region within the context of the COVID-19 pandemic. So Dhevy, thank you again for joining us, and the floor is yours.
Thanks so much, Giada, and also James. As Giada mentioned, my name is Dhevy, and I'm Asia Pacific Policy Council for AccessNow. I lead our work on Southeast Asia. So I think today I'm just going to speak on a general regional overview of what we've seen with false information laws in the region. And as James and Giada mentioned in their presentations, it's very clear to us that across Southeast Asia, countries are adopting a securitization approach to expand rights violations, not only offline, but also online. And they're using national security and maintaining public order as key justifications. And in this effort, they're abusing both laws and technologies to advance political aims. At least in this region, it's not really surprising because Southeast Asia has not had like a stellar record in protecting rights, especially freedom of expression, and especially online. And the language of national security and public order has been relied on before, and it's exactly the same now in COVID-19. But the pandemic has accentuated this language of fighting threats. So what I'll be focusing on today is how governments have like abused this narrative of fighting false information online to sort of extend what are essentially political aims within the country, whether it's online or offline. So on false information laws, I think I'll start off also by saying this is not just like a problem for Southeast Asia, right? It's a global challenge now, because like for the first time in human history, like most people in the world can access the most amount of information they have ever done, and most people can also share the most amount of information they have ever done. But at the same time, there's like increasing inequality and deterioration of public trust in government, and tech companies are having disproportionate control on what kind of information gets circulated online. So there is a societal sort of crisis of whether to trust the vast informations that's online. And this is the case even in countries with free media and democratic safeguards. So of course, in Southeast Asia, they're gonna, this is going to be abused. And in a volatile context, when you throw in a pandemic, it becomes very obvious to governments online. They can see the lack of trust of their people and their fear translating very publicly on social media platforms. And it becomes a perfect opportunity for them to then clamp down on criticism. So COVID-19 has essentially in this region, like provided a disingenuous justification for them. I'm also going to start with Thailand, and it's great that James and Giada have already spoken about it before, because people are being arrested now for releasing like what they call false information on COVID-19 under the emergency decree that James alluded to, but also under like Computer-Related Crimes Act and other laws which impose fines and imprisonment terms for posting stuff that the government deems is false online. But at the same time, there's a crisis in COVID mismanagement. So the government has been severely criticized for not manufacturing or rolling out the vaccine fast enough, and there are increasing numbers of cases and deaths across the country. And at the same time, there are also protests raging in the country, and there are news of like, authorities using water cannons, rubber bullets against their people. So instead of listening to these people, what the government is actually doing is clamping down on criticism online by claiming it's fake because they can't control the dissent. And artists, students, and opposition politicians have been charged under the Computer-Related Crimes Act and Les Majest law for legitimately criticizing things like the vaccine rollout. And meanwhile, the government is not providing its people with trusted information on the virus or the truth about how it is managing the crisis. And marginalized groups are suffering the most, as the report also highlighted in the other 5 countries. In Thailand, refugees, LGBTI, indigenous people, sex workers, imprisoned populations, and disabled people are being affected more than the average populations. And similarly, in Vietnam, a law was brought into force that would imprison people for up to 7 years for spreading false information on COVID-19. And this is a very severe penalty, and it's disproportionate to the aim of protecting public health, because what it ends up doing is results in a chilling effect on expression online, because people then feel scared to post or share information on the virus, which is what you don't want in the middle of a pandemic, because you want people to be able to share information on the virus and the government's handling of it, because this right to information is a component of, and it's a way to protect the right to health as well. And this chilling effect is more pressing in a country like Vietnam because it already has a terrible track record for like targeting criticism of the government online. It has thrown human rights defenders, journalists, and writers for decades in prison for Facebook posts and YouTube videos where they basically criticize the government. Also in Cambodia, laws on false information have been used to target legitimate criticism of the state's response to the pandemic. So in 2020 and 2021, there was a hike in arrests of people for posting false information, apparently on COVID-19. The majority of those arrested were former political opposition party members, and you know the previous election in Cambodia where the political opposition party was actually dissolved, and these were the former members of this party who were mostly arrested. But they haven't just arrested opposition members, they arrested a 14-year-old girl when she shared on social media that she was concerned about COVID-19 cases in a school and province. They also arrested journalist Sovan Rithi for quoting verbatim what the Prime Minister has said. The Prime Minister has said, if motorbike taxi drivers go bankrupt because of the pandemic, you sell your motorbikes for spending money. The government does not have the ability to help. That's what the PM said, and that's what the journalist reported. And for that, he was charged with incitement to commit a felony and had his online broadcasting license revoked. And in Cambodia, there's also now a law on measures to prevent COVID-19, where people can be imprisoned for up to 20 years for posting false information online. And earlier this year, 3 people were prosecuted under this law for TikTok videos that criticize the use of Chinese-made vaccines. So it is like evident in these countries, the efforts to target false information online, they do not meet international legal obligations, right? They do not meet the requirements of legality, necessity, or proportionality. And criminal sanctions are disproportionate because they only make people more fearful of sharing information online. And these laws are also unnecessary to begin with if states focus on providing clear, trusted, timely updates on the virus and the pandemic. Because if they provide access to this information to everyone without discrimination, then they would not need to have false information laws. And importantly, they should allow journalists, opposition politicians, and health professionals to do their professional duties and report truthfully on the crisis, because it helps everyone in a time of crisis. And what is really important is that people should be able to trust the governments and trust that the information that is coming to them is truthful and accurate. What actually increases the spread of rumors online is when the state itself is denying people of information or spreading false information itself. Instead, they should be investing in people-centered social programs and investment, like building public trust by actually listening to the population, reducing corruption, and building digital literacy and education of their people. And at the very minimum, as of now, to be transparent and right-centered in the way they're handling the pandemic. So basically be clear about what they're doing, which is not the case in Southeast Asia. So I think I'll stop there for now on that.
Thank you so much, Dhevy. Again, this was really useful and comprehensive. And I think you continued on sort of James' topic of the pandemic accentuating trends that are really not new, neither in Asia nor beyond, but that we are seeing more and more since the start of 2020. For you, particularly the abuse of law and technology for political aim, the shrinking of civil society space, the use of censorship online and offline that really can affect the democracy in the long term. It's really interesting that you mentioned social media and the role of private actors. Maybe this is something we can go back to during the Q&A session, because they also have a responsibility when it comes to information, misinformation, and transparency. And I think one of the lessons for us as civil society is that we really need to be much more attentive to what happens in the online space. And this is why the work that, for example, AccessNow does is so important. Because on one side, we see increased censorship and control, but on the other side, we really see a failure of governments to provide evidence-based, accessible, clear, trusted, real information on what's happening with the pandemic and how to address it. And again, once again, vulnerable communities are the most affected. It's interesting that you mentioned the importance that civil society sort of oversees and monitors what the government does and the kind of information that the government provides, because this is one of the core focuses of Lapor COVID-19, the coalition of Indonesian NGOs and civil society and individuals that was recently co-created by our next speaker. Our next speaker is Irma Hidayana, again, co-founder and co-leader of Lapor COVID-19, which is this broad group of individuals and NGOs who monitor and advocate on the human rights and public health implications of the COVID-19 response in Indonesia. And we're really focusing on empowering the population to monitor what the government does and also ensure that credible and realistic information goes back then to the population. Mrs. Hidayana is also a public health activist and professional with a PhD in health and behavior studies from Columbia University. And she will tell us more about how the executive handled the pandemic in Indonesia, also addressing the overexpansion of law enforcement powers in the country. Irma, the floor is yours, and thanks for being with us today.
Thank you so much, Giada. Hello, everyone. Thank you so much for having me. So I'm here speaking on behalf of Lapor COVID-19. I'm going to tell you briefly about how the government of Indonesia responding the COVID-19 situations. In brief, actually, I have two main issues that I will bring up to these sessions. First of all, is we are facing a very great challenge in data transparency, as what have just Giada mentioned, that we really strive for evidence-based, transparent accountability of COVID-19 data, and how we use the data transparency and data accountability, or the data that is reflecting the real situations on the ground, to be based as policy making process and the policy making and actions to respond to the what is going on right now in regards to COVID-19. So in terms with the data transparency, actually Indonesia has no open data on the testing, PCR testing at the sub-regional level. Like, for example, as you know that we have 514 cities across Indonesia. But none of single cities in city level actually have actually published their PCR testing. This is a big deal, actually, because we know that the only thing that we know the real situations of the spread of the virus at the community level is actually by knowing that how many testing that they do every day. And then from the test, we know that how many positive cases that we found from the test. Instead, the government always publicly and publicly publish official data on only the number of new cases, which could cause a misleading information and situations on seeing how much the spread of the virus in the community level. We also talk about death and then the death discrepancy data earlier. Indonesia also have challenge and data transparency problems on death data that related to COVID-19. So first of all, the figures that is always released and published by the officials, authorities at the national level, it's always have a huge gap. Normally, what is published by the national level government are less, the data always less than what is published by the sub-regional or city level or province level. For example, the death data, for example, it's always been lower or smaller when it is published by national level as compared to the provincial or city level. And as for now, Lapor COVID, our organizations have recorded that at least there were almost 2,000 deaths of healthcare workers across Indonesia. This is only what we have recorded. I believe that the number may be higher, the real number may be higher, because we are also facing that people do not want to publish the death death due to COVID-19 because of the stigmatizations. We also have lack of transparency on the vaccine distribution, vaccine site effects, and also the distributions of social assistance. But the most important issue that I want to highlight here is actually that economic interest has always been put as a top priority than a public health interest. We have a lack of epidemiological surveillance in terms of testing, tracing, treatment. As I mentioned earlier, that our number of testing is not published at the city level. Normally the government only publish at the national level, and some province also publish it, but not all provinces across Indonesia, which we have 34 provinces in Indonesia. They don't really publish the number of daily testing, which is very important as a epidemiological surveillance database. Unfortunately, we don't have it all. And then social mixing, public health social measures is also another component that the government is not really doing a consistent public health social measure. So we have a kind of like fluctuative a policy in terms of restrictions of social measures, like relaxations has always been the case. The government has always put the economic interest, like the interest of actually not the small traders like in the traditional market, but normally to be in favor of private sectors, the big private sector, for example. So that's why they opened the economic sectors, while this could cause the labor has to travel from their own house, their own area, to the plantations that they work with, like for example to the office, to the big factories that they worked. And then in terms of commuting or transporting from their own house to the job, for example, they have to go through with securitizations. The police will wait for them and then we'll ask them, why are you going to work? So this is you have to stay at home. But in contrast, actually they have to go to the office, because otherwise they will not get paid to pay the bill for their economy, their domestic needs. We also have vaccine equity problems, where the governments normally always they don't really follow the recommendation of WHO in terms of rolling out the vaccination to the vulnerable groups. Like for example, yes, for the health workers, the government has been focusing on vaccinated them at the first phase. But what happened in the second phase was actually the government also mixed them. So like there were non-vulnerable groups that has been receiving vaccination, and the number is quite huge actually. This including the YouTuber and celebrities, and those whoever it is who has 1,000 or even million followers on the social medias. Another real problem that we are facing is actually the role of police and military institutions in COVID response. So since the beginning, day one of COVID-19 response in Indonesia, actually we have the COVID-19 task force structures in response to this pandemic. But unfortunately, this task force is led by the military institutions, not by the health body or health institutions. And actually, it's the case is still the same now, but it's slightly different since the task force is slightly changed. Right now, it's been taken over by the economic institution. So rather than leading by the health sectors, COVID-19 response in Indonesia is actually mainly led by military institution and also economic institutions. This is also the case of the interventions, including the testing, tracings, and also treatments. So military institutions have been deeply involved in testing, not only to do the test of the community, not only providing testing for the community, but also in procuring testing kits and some other supplies for with regards to COVID response needs. On the ground, we also found violence approached by the military's members, like one huge thing that is actually uncovered, violence by militaries against health workers has actually happened in early of these years because of the network of healthcare workers who works to take care of COVID-19 patients. They didn't get their incentive. They're actually volunteers, and then the government regulations mandate the government to pay to give them incentives monthly. But unfortunately, these volunteers, healthcare volunteers, they didn't get their incentive as promised by the government for over 5 months, 6 months. And then when they speak up, the military's members intimidated them, pressured them, and then some of them did not. They were fired, and the contract did not renew by the government. And corporal punishment also been heavily used in terms of for health protocols adherence, and then. Going back to the situation, democratic and political situation in Indonesia, actually over the past 1.5 years, Indonesia has been facing a shrunken civic space situation. So the government passed the omnibus law on job creation bill. Like, for example, this actually there's been a huge protest on the street, and then there are also a big protest by students, college students nationally. But this situation has been used by military to do corporal punishments and then violence, and then on behalf of COVID pandemic. So they actually use the quarantine law, national quarantine law in responding the protesters across Indonesia. But on the other side, this quarantine health law doesn't really implement when it comes to the government responsibility to fulfill the needs of like access to medical care, access to vaccinations, and also access to staples or basic needs of people who are living in the area that are implementing health quarantines. So overall, that's what I can share with you. Sorry, just one more thing. I think I remember that George mentioned about surveillance and data privacy. Indonesia also facing this crisis actually. The national application that is created by the government is actually facing a leak for so many times. And then just recently, earlier this week, actually, the data of presidents and some elites, national Indonesia is also leaked, but then the government decided to close down. But what happened if the people, like the community, would protesting about this data privacy? They would be criminalized by the government. I think that's all from me. Thank you so much, and over to you, Giada.
Thank you so much, Irma. This was, again, an amazing overview of a very complex and also very dynamic situation in Indonesia. I just want to mention to the attendees and the participants that Lapor COVID-19 has a very rich website with a lot of resources on the situation in the country. So if you want to know more, please go and check their website. Thanks, Irma, for highlighting these issues of evidence, transparency, and accountability, and also for reminding us that actually data shape policies, and that what the government counts and how they count it becomes then essential to develop those policies. too often we see governments sort of underplaying or overplaying certain data to justify their ineffective policies. It's something that we see in the drug control space, and now we see that very much with COVID-19. I think Indonesia is a very clear example of how governments have almost this automatic tendency, this reflex, to focus on security and control when they have an emergency to deal with, to center law enforcement. And again, a briefing that was recently published by Lapor COVID-19 illustrates very well how the COVID response in Indonesia was all around law enforcement and the military. Public health professionals were almost were sidelined and almost ignored. This failure to involve health professionals, civil society, and community led to a policy and the response that was ineffective and unrealistic. And also, as Irma mentioned, there was too little attention to the social determinants of health. So to ensure that people have food, housing, and income to deal with. So something material and practical that allows them to comply with the laws that the government puts in place. And so we had this not only in Indonesia, but all across Asia and beyond Asia, this situation whereby people didn't have any choice but to not comply with the regulations because they needed food, they needed health, they needed services, and then to be punished for that. We now move to Malaysia with Dr. Hartini Zainudin. Dr. Hartini is a child activist in Malaysia and currently a consultant for a local human rights organization. She was Southeast Asia's focal person for a UN organization. Among other things, she's also the co-founder of Yayasan Chokit, an NGO addressing child rights and protection through services in Kuala Lumpur. Tini was also a member of the Ministry of Women, Family and Community Development's National Advisory Council on the welfare and protection of children, and she has worked very closely with UNHCR and UNICEF Malaysia. She will tell us more about how the pandemic and the government response in Malaysia is impacted on vulnerable communities. I just need to mention that Katrina Malyamau was supposed to be on our panel today. She had to pull out at the last minute for a personal emergency. We approached Dr. Tini at the very, very, very last minute, and she very kindly agreed to join us. So I need to say thank you again for saving the day and for being with us today. And Dr. Tini, the floor is yours.
Thank you, Giada, for that introduction. Hello, everyone. Thank you so much to the organizers for inviting me here today and to give me the space to be able to say a couple of things of what's happening on the ground in terms of the impact on migrants and marginalized groups. Just in a nutshell, Malaysia has about 7 million migrant workers, of which half have work permits to stay and work in the country, and about half don't. And we also have on top of that about 182,000 registered refugees with UNHCR, and we have a number of refugees who aren't registered with UNHCR. On top of that too, we have about, we're not supposed to say numbers, but roughly in one of the biggest states in Malaysia, Sabah, we have about more than a million stateless people. And many more in Peninsular Malaysia. So roughly we've got quite a large number of people who are considered marginalized on top of, Aborigines, etc. and stuff. But the focus is on migrants, whether it's regular or irregular, and the impact. And prior to COVID-19, the COVID-19 outbreak, migrant workers in particular were already, including refugees and stateless, were already living in cramped workers accommodations and, with very unsanitary conditions and with poor access to healthcare, if any, very minimal and very low quality access to begin with, unless you can pay. Refugees are not allowed to work. Malaysia is not a signatory to the UN Convention on the Rights of Refugees, nor are we signatories to the Convention on Statelessness. And we do not allow children who are of migrants or refugees or stateless to have equal and quality access to education or health services. So it's already been dire to begin with, but like many places, the pandemic highlighted the differences between the have and have-nots and the implementation of various phases of the Malaysian Movement Control Order, or the MCOs, and the way the government handled and address the situation facing migrant workers had significant negative impacts on their already precarious living and working conditions. So that's in a nutshell. Anyway, so what happened at the same time all this was going on, I have to mention and touch upon the point that there is political turmoil in Malaysia. When we had the first MCO, the government then was overthrown and taken over by another group of politicians. And then recently, about 3 weeks ago, our government was again, our prime minister had to step down and another prime minister had to take place. Amongst all this, we had an emergency order and we had this political turmoil and we have this pandemic. So it was really chaotic in terms of looking at policies and being able to advocate for better conditions and access to vaccines for migrants and non-Malaysians who were poor and marginalized. So all this was going on. Anybody who questioned, like many places, anybody who questioned, documented or highlighted the horrible situations of migrants or refugees or stateless were harassed, were questioned, were hunted down, especially if they were migrants themselves who spoke out, deported, placed in detention centers. And it has been a harrowing journey in terms of hundreds of thousands of migrants, regular or irregular, including stateless and refugees. And the impact has been horrendous on those even more vulnerable amongst the different marginalized groups, especially children. I wanted to highlight 3 points about what's happening and just to sort of present an overview of what's happening. My focus is children in particular, but just in a nutshell, because you can't protect children if you don't protect the parents and if you don't protect the communities. The pandemic and the subsequent lockdown was used really as a way to sort of intensify the attacks on migrants and whip up hatred. I mean, the xenophobia was at an all-pitch high since April of last year. And there was a round of raids that happened from May onward. Everybody who was caught in that raid, women, children, babies. And this fear was really an attack in particular against the Rohingyas, yes, but against migrant workers as well. If you're poor, you're marginalized, you're non-Malaysian, you're most probably at risk of being harassed and detained. So when we're talking about the May riots of May raids of last year, and you have this imagery of you know, this whole idea that Pati, which is a Malaysian word for pendatang asing tanpa izin, or foreigners, migrants who are here without permission, that's really what it is, was linked to this invasion of COVID infections and this invasion of non-Malaysian refugees and migrants coming here and infecting the Malaysian population. And that was an image that was repeated and highlighted and enhanced over and over and over again. You can see them till today on Facebook posts, on national security Facebook pages. You see them on the immigration department posters. You see them in many places. And that was in direct conflict to what the minister who was in charge of you know, ensuring that we had vaccine distribution and vaccination of migrants was saying. So there were two ministries going at it at the same time, and different agencies in conflict with one another, one saying, let's vaccinate everyone, and then the other one going in saying, we're going to arrest you. And so it was also revealed that if you only see the migrant body as a threat or a tool to be contained, then you'll utterly fail. So that was it, that you would utterly fail at any kind of public health response. That was what we advocates were saying, but it kept falling on deaf ears over the months. And it's only recently, actually in the last week, since we had this new Minister of Health, that you've actually seen the vaccination of only registered refugees, not of migrant workers, not of stateless, just registered refugees. So, you know, this whole idea of villainizing migrants and anybody and refugees is continuing. And because that the security framework, it cannot be, is completely incompatible with care. And you cannot keep Malaysia being so divisive and exclusive at the risk of, dividing certain groups while others get vaccinated. And this conversation has been going on, like I said, for a long time. That's point one. Point two, the conflicting positions that I mentioned has caused so much confusion and so much fear that even if the migrants did want to step forward to get vaccinated, there's so much confusion and reluctance of where they go. We have one center now that's vaccinating migrants in one center, but the wait is 4.5 hours long. And then apparently there's conversations of corruption of immigration officers and police officers and enforcers who they're already afraid of, asking for coffee money, anywhere from 50 ringgit to 150 ringgit, which is, a lot of money for migrants, considering the fact that most of them are out of work. They're not allowed to work if you don't have permits, and migrants and refugees, and it's just an impossible situation for them now. It's just absolutely outrageous. And so now what's having to happen is, because of these different SOPs, different policies, different conflicting rules and regulations, doctors and non-government organizations and humanitarian organizations are having to go down to the ground and actually trying to persuade migrants and refugees and stateless people to come out to get vaccinated. And it is such a long, drawn out process. I'll give you an example. I work for a local humanitarian organization here in Malaysia as a consultant. And today, we're working with WHO, looking at, putting out perception surveys so that we can gauge how migrants feel about being vaccinated. We can't even complete it from last year because the migrants won't come out because they're just terrified of what's going on. And because, like many other countries, there's a whole issue on data privacy and what the data is being used for. From the past, the previous government had promised that if migrants stepped forward, that they would not get detained or arrested. And what happened was they were detained and arrested. So to ask migrants to step forward again, or even participate in perception surveys, or to be able to come out and just talk about, what their fears are, or getting others to come forward, is just an almost impossible task. And so there's this need to sort of reframe the policy that if you get rid of migrants, both regular and irregular, you won't have such a high COVID infection. There's actually a poster that came out last week, which was just so shocking, where the the Security Council actually posted the number of migrants who are actually infected and the numbers were something ridiculous, like, the month of July, there was 6, the month of August, there were 9, the month of September, whatever, it was some crazy number, when our rates were something like 24,000 infected for the day, and so it was such a ridiculous poster that was there, but it was such a deliberate narrative that was being used to sort of whip up this hatred and fear of migrants. And so there's this need to be able to change this narrative and advocate. One of the things that I'm doing as a child activist is, of course, looking at the plight of children. And as I said earlier, the impact on children in these marginalized communities is horrendous. To give you an example, and I'm not a medical doctor, nor am I a public health associate, but it's just simple numbers, right? I work in very, very marginalized groups in Sabah, which is one of the biggest states that I mentioned that had, about 1 million stateless people. So I work in a couple of villages within a week from last Saturday, maybe the Friday before till today. So it's almost 2 weeks actually. But we had 6 children die. 6 children die because there was no access to health. The parents who couldn't afford or were too afraid to bring the children to the hospitals. Mothers who were delivering babies at home because they were so afraid and they didn't have the money to go to the hospital, and the baby died during childbirth. It was horrific stories. 2 of the children died with breathing problems. We till today don't even know if they had COVID or they had respiratory problems or what the issue was. They just died, and literally died before my eyes because the parents were actually videotaping what was happening to them on a day-to-day. Within 5 days, this child who was less than 2 years old died. And, and because they had no money to bury the child, we were racing around trying to raise money for it. And the impact, never mind on the child and the suffering with the parents was one, but the siblings saw all what was going on. So you see that. You see a rise in scabies. Every day, I get about 100 pleas for food from Sabah alone, yeah? So we have 14 states, 100, of which maybe 10 of those pictures that they send me are of children with scabies and TB and, you know, all these respiratory problems that I have no idea what's going on because I'm here in Kuala Lumpur. There's no online access to schools. There is absolutely nothing for them. And there's malnutrition. Obviously, there's no clean water, which is why they have scabies. But there's just absolutely no food. People say that you can pluck vegetables on the side of the drain so that you can have some vitamin C to go with your food, except they have no rice. And the vegetables that they were supposed to grow on the side of the drains have disappeared because everybody's doing the same thing. There's no food. There's a genuine fear of detention. As you give food, the government gives you piles of food. If you're lucky enough, if you're Malaysian, you get food because, I'm sorry, but you know, marginalized groups live and side by side with Malaysians. So the Malaysians will get the food packets. They actually raid and find out and asks people for their ICs or IDs, ID cards. And if you don't have it, you get arrested on the spot. Parents were taken away in front of their children in entire villages, leaving children as young as 5 years old in charge of the household with no idea how to get food. This is how terrible it is. Deliveries of babies didn't happen, like I mentioned. People, migrants and refugees, mothers were delivering babies outside the emergency room because they didn't even get in to the hospital. Yes, there were already issues and this was already existence, but the alarming rate of scabies, the alarming rate of babies dying during delivery is something I've never seen in all the 41 years of working on child rights in Malaysia. Never, not like this. So, you know, we've been highlighting this issue. I've been documenting the cases. I've been collecting photos. I've been collecting stories. I've been posting on social media. I have not been arrested yet, thank God. But, you know, looking ahead, now that we have this new health minister, who was the minister actually in charge of vaccine distribution, I'm hoping that things will change. I'm hoping that you know, the policies change and that we treat and I don't want to say police, that we treat people equally and that migrants and the children in the communities will have a better shot at having access to health services and that the vaccination actually the vaccination distribution actually does reach all the migrant workers. I wish we had answers, and I'm actually looking forward to the discussion so I can hear a lot more and get advice from all of you. I'm actually going to Sabah next week, so I'm just like dragging people with me to sort of document and get medical health experts as well to help me document all the cases and see how we move forward. But it is a dire situation if you're marginalized and poor and non-Malaysian in Malaysia right now. Thank you very much.
Thank you, Dr. Tinian. This is such an horrific situation that you are describing, and I think it's very clear from what you say how a poor COVID response is impacting not only COVID, but is really having a huge impact on the health and livelihood of marginalized communities. And we saw migrants being targeted, detained, blamed, as you were saying, for spreading the virus, when actually the problem was the government being unable to deal effectively with the pandemic and trying to move attention away from its failures. I just want to quickly mention that for those of you who are interested in this issue and in the situation in Malaysia, our colleagues in the country are organizing another webinar to follow up on this discussion. It's co-hosted by CIRIA, the Center of Excellence for Research in AIDS at University Malaysia and HRI. It will be co-chaired by members of parliament in Malaysia, and it will happen on 24th of September. So we really invite all of you to join the discussion and to have a further conversation with us on solutions and recommendations. Now, last but not least, we move to the Philippines and to Dr. Josh San Pedro, co-convener of the Coalition for People's Rights to Health. Josh is a graduate of both anthropology and medicine from the University of the Philippines and the community physician for the Council for Health and Development, working with community-based health programs across the country. Josh will talk about the militarization of the COVID-19 response in the Philippines and the effectiveness or not effectiveness of the strategy. Josh, you have 8 minutes and the floor is yours.
All right, thank you very much, Giada, and to our other speakers. I can really relate. A lot of the situations are very, very similar to what the Philippines is currently experiencing, especially the experiences in Indonesia and Malaysia are very, very familiar. It's as if what we are hearing is exactly what is going on in our country. So today, again, I'm Dr. Johnson Pedro, the co-convener for the Coalition for People's Right to Health in the Philippines. And today I'll be discussing the securitization or the militarization of the pandemic response in the Philippines. So as you can see in the pictures, it was a nice explanation earlier to show the difference between securitization and militarization. But in the Philippines, I would like to add that it's a very militarized response using the police, as mentioned earlier. But I understand that using the police is more similar to securitization, but I will also show how it is very, very similar to what militarization is actually happening. Right. So the Philippines is currently very similar with other countries in the Asian region. We have over 2 million cases, second to Indonesia in the Southeast Asian region, but the first in the WHO Western Pacific region with over 2.1 million cases as of yesterday. So the leadership of our COVID-19 response in the Philippines mostly revolves around two organizations, the IATF, the Interagency Task Force on Emerging Infectious Diseases, and the National Task Force to End COVID-19. Now, the IATF is nominally headed by our Health Secretary, but it is under the office of the President. The National Task Force, however, is the one that implements what the Interagency Task Force comes up with in terms of policies. So the NTF, or the National Task Force to End COVID-19, has a chief implementer and a deputy chief implementer, which is under the Office of Civil Defense and ultimately under the Department of National Defense. And this is where it directly becomes under a military framework in some ways. So there are 5 czars. No, the Philippines use the term czars for those who will be leading the 5 important parts of our COVID-19 response: the testing, contact tracing, quarantine and isolation, treatment, and vaccines. But only one of these 5 czars is actually a health worker. 2 of them, the contact tracing czar and the vaccine czar, is a retired police general and a retired army general. So there is that securitization or militarization aspect. And overall, these 2 agencies decide on the severity, the duration, and the implementation of the various levels of our quarantine restrictions. So these 3 agencies are the ones that are in charge of the longest lockdown. The Philippines has never gone out of community quarantine since the start of our pandemic in March. So unfortunately, the healthcare system has long been fragmented and severely underfunded, which leads to an increase in the reliance of security personnel, especially in enforcing lockdowns, checkpoints, and curfews during this time. The police likes to frame it in another way, that COVID-19 responses is similar to looking for suspects, since COVID-19 uses the term suspect in the WHO guidelines, and thus close contacts can also be likened to accomplices. Therefore, the argument is that the system for tracing cases of COVID-19 is very much similar to the framework that the police use on a daily basis. And they have also been used as contact tracers because of that concept of tracing the suspects, tracing the accomplices in that very manner. There is a shifting responsibility for health. We know that it is a constitutional role that the state shall promote and protect the right to health of the people. But we still see among the implementers of our task force things like this, that the deputy chief implementer of our COVID-19 response also mentions that it's not actually the testing, it's not actually the tracing, it's not the advancement of the healthcare system or technology, but really a matter of discipline. And by framing it as a matter of discipline, it shifts from a health aspect into a law and order aspect, because the argument is that it is a problem of discipline. that was from the deputy chief implementer, and then the chief implementer actually magnifies this in his double role as both the chief implementer for COVID-19 response and the vaccine czar. It doubles in his role, and he views it also as a matter of discipline, especially with regards to vaccine hesitancy. And by pushing this kind of discourse, it eventually leads a lot of Filipinos to believe that the majority of the progression, the reason why our cases are still so high, is because of these people who are not able to comply with quarantine protocols, or what we call the pasaway, or those who refuse. No? And thus, it is no longer a problem of COVID-19 response. It is a matter of discipline, once again. And these state security forces are thus then mobilized to further that need to fight against these pasaways, those who violate quarantine protocols. And thus there have been many punishments for those who are violating the protocols, such as not wearing face masks, not wearing face shields. The Philippines mandates face shield wearing for every citizen, as well as a curfew, depending on the quarantine level, the ability to go around in your communities. So this is something that is quite slightly similar to Indonesia, where coffins were used. I know that in Indonesia, ghosts were used, but in the Philippines, during the hardest lockdown, we were using coffins in checkpoints to tell people that if you stay inside your house, either you do that or you stay inside a coffin, or leading to your death. And many quarantine violators, for those who violated curfew, for example, they were either stuck inside dog cages, some were even made to stay under the sun, and some were even pushed to exercise or massive physical activity during that time. And we saw really the need for a lot of things like this to happen. That there were even the mobilization of armed personnel carriers by the police and the military to ensure those checkpoints and those curfews. And this is also in the report by the Asia Center, but in the hardest lockdown, that lockdown period between March to May 2020, if we look at the people who were warned, fined, and arrested for violating quarantines, it is actually much more than the people who were tested for COVID-19 in the same time period. So we were actually more focused on arresting, again, the quarantine violators, instead of finding out the spread of COVID-19 in our communities. So it basically is a matter of policy, because the presidential reports that were seen almost every week, we would hear things like those who were not wearing masks should be arrested, that those who were possibly spreading it should be arrested, those who did not want to be vaccinated ought to be arrested, that they would be escorted back to their homes and not allowed to go out. And we would see these, that we saw high-powered rifles really going around the communities to police that. And of course, there's that shoot-to-kill order for quarantine violators that also came out. And that actually did lead to some deaths. We saw quarantine violators, at least 3 who were killed. 2 of them actually had mental illnesses, and we were not understood, unfortunately, by the security forces. And ultimately, that leads to a lot of distrust and a lack of solidarity in the COVID-19 response in the country. And the poor, of course, suffer the most because of the lack of privilege. The distrust with the local government and the health system also, that COVID-19 is seen, unfortunately, because of how difficult the health system is and the political situation is, that it's seen as, unfortunately, a scam that profits from the poor, instead of something that is really a matter of public health concern. And there are arrests and threats, as mentioned earlier, instead of support and reassurance in this crisis. And we see that continues to persist. Also, the anti-insurgency efforts and the drug war. So, despite the people's attempt to argue for a more comprehensive COVID-19 response, it is actually met with with a lot of other threats. So, for example, a lot of organizations have called for mass testing, a wider amount of testing, such as what Indonesia has mentioned, but that has led to a pushback by even linking mass testing to an anti-communist propaganda, that we have a national task force to end local communist armed conflict in the Philippines actually saying that mass testing, that clamor for it, as mentioned earlier, is actually something that is red tagged, or what we call in the Philippines as linked to being to the communist insurgency. And it continues to be a matter of propaganda as well, that anyone who is calling for less for a better COVID-19 response, which is mass testing, increasing the social amelioration, and then increasing really a more humanistic COVID-19 response, are seen as terroristic behavior. And that has led to also even the deaths of two health workers in communities, of Zara Alvarez and Dr. Mary Rose Ancelan, who actually have been campaigning, for a more holistic response. And even health workers do not just die from COVID-19, but even from harassment during this time. And it is really parallel to end. It's really parallel as well, aside from the anti-insurgency efforts, to also the war on drugs. We are seeing quite a similar discourse. We are seeing responses and incentives for communities, or what we call in the Philippines barangays, to be COVID-free, which you can never really find out except if you're testing that wide. But a lot of them do want to be called COVID-free, in the same way that in the drug war, they wanted to be called drug-free. So it's very, very similar. There are a lot of parallels in this system, that there is that incentive for a community to be COVID-free, or at least be nominally COVID-free, in the same way that we wanted it in the drug war. And then, of course, the response, that those who are spreading COVID-19, or even the pandemic itself, is being seen as a possible case for murder. Those who are shunning protocols should be charged with murder, in the same way that the administration sees the drug addicts and those who are drug pushers as destroying the country. So it's very similar in terms of how the pandemic is being viewed, especially with what happened to the drug war as well. So at the end of the day, it's really the fragmentation, the neglect of our healthcare system that really leads to a different perspective, or a perspective that really wants to focus on securitization, on a law and order issue instead of a health issue. That's cheaper. That is much cheaper. That is much easier for a government to focus on a law and order perspective instead of overhauling a health response that is very much needed in this public health and economic crisis. Thank you very much.
Thank you so much, Josh. And we got a question, like moving to the Q&A session. I know we're a bit late, but all your presentations were really important and really interesting. So I take responsibility for being a bit late here. We have a question on the Philippines, so I thought I would jump right back to you. And someone from the floor is asking, how did the public view, or how does the public view of the current administration's management of the pandemic affect Duterte's vice presidential bid for 2022? And if I can ask add to this question, maybe, how do you think, knowing that there's an election coming soon, affected the government response and is very focused on control and on law and order? Thank you.
Right. So, well, with President Duterte saying that he will be running for vice president, he claims to be wanting continuity with the present projects, the direction, and well, there are still some segments of the population that are very much okay with that. There are, of course, increasing dissent to the way the pandemic is destroying the way of life, and how this is ruining the economy, and even the Duterte himself is saying that we cannot just focus on health, we cannot just focus on the economy, and he's having a very difficult time, and saying that nobody is ever really prepared for this. And even saying that if we could name a country that was prepared for the pandemic, he would offer his resignation. And this is something that is a very unfortunate thing now that we, instead of analyzing really what must be done during this pandemic, there is this drama, which is very much in line with, again, with the election season coming up. And this is becoming also a problem, especially with vaccines being politicized. Now, there's always that threat that the pandemic response will be politicized in time for the election. And unfortunately, there's also that sense that people are losing focus during this time. Again, the Philippines is seeing its record high cases during this time, and it seems that many of those who are currently in power seem to be distracted with the reality that the elections are coming up and funds must be realigned to that. And there are those who are already doing mass gatherings for their political campaigns, or the meetings for their electoral plans. And unfortunately, it causes again that a major distraction from the pandemic response and what must be done during this time.
Perfect. Thank you so much, Josh. I have a question which I guess is addressed to Dhevy. So what do you think the long-term, so, we were talking about the risk that policies and laws introduced during the pandemic will actually overstay the pandemic, either because they were built into normal law or through other means. So what do you think could be the long-term impacts of these misinformation and fake news laws? Are they there to stay? Is there a way to roll back on them? And how can civil society respond to this trend and to this sort of increase in online control? Thank you.
Yeah, I think what you mentioned about laws, once they're in force, it's very hard to roll them back. What we try to do as civil society is always try to prevent them from even coming into force in the first place. But as you see in places like Malaysia, there was actually the Anti-Fake News Act, which was repealed by the previous government and now has come into force as an emergency ordinance, which is the second one. And that ordinance right now, not sure whether it's in force because of the the chaos in the political situation. But it shows that, bad laws can actually come back into force, and the ones that already are there will just continue to be abused, because if they're already drafted in a very overbroad, vague manner, they can be abused quite easily. And if the states are willing to push it through, regardless of these human rights challenges, then they will be implementing the laws in a very abusive way as well. And I think I could also draw similarities with contact tracing here, because that's the same thing you would talk about contact tracing efforts. The moment you bring into force surveillance related mechanisms like contact tracing, which are not, they don't protect privacy and they don't have enough data protection sort of safeguards, then the moment it's there, the data that is in these apps they're basically viable for misuse, because the governments are just tempted to use the information for other means other than just COVID-19. And I think that's the problem now, is that these emergency laws and these fake news laws and also these contact tracing efforts are vague and overbroad, and they are viable for abuse. And once they're in, they can't be removed. It's very hard to get them out.
Yeah, that makes a lot of sense, unfortunately. And contact tracing is not something that we managed to touch upon a lot, but is a key theme in the report that the Asia Center produced. So I think for those of you who want to know more, maybe that's a good starting point. You rightly mentioned this potential of contact tracing to be used for other means. And just a small reminder that in Singapore, for example, in the early days, we had countries around the world sort of praising Singapore for the effective response. The use of technology and contact tracing was very widespread, but then we saw that data collected through contact tracing applications and technology could also be used to conduct criminal investigations with a lot of sort of data privacy and security issues. And I think that's a very good example of how, contact tracing and security can go wrong. I have one more question, and I think that's a good question for maybe all of you to keep as a wrap-up question. If you could give one recommendation to your government or to governments, for those of you who addressed regional overviews, for a response that's really effective, not only from a human rights, but also from a public health standpoint, And if it could only be one, which recommendation would it be? So maybe starting from James, as he was the first speaker.
I think it's really about paying attention to the moving needle, because the vaccine response has changed. And I think as we move to the endemic situation, and I think as we move to, ensuring, more people get vaccine and so on, I think governments need to put into place very standard long-term measures that should be open for scrutiny and consultative approach. Because I think as governments prepare and the people prepare for a long-term haul, any mechanism, so more consultation in a more transparent manner for long-term health protocols to be put in place.
Yeah, absolutely. Thanks. Dhevy, back to you.
I think because I spoke the false information laws, my recommendation would be on the laws, and it would be to not have them at all in this region, because I think if you were very, as James said, you had a consultative approach and you actually genuinely listen to the people, and you're getting involved in government efforts that are genuinely listening to the populace and actually advancing what their health concerns are, and you're sharing information regularly and it's trusted information, there's no need for false information laws.
Right, thank you. Irma?
Yeah, I think it would be for the Indonesian government, and I think for all government in the regions, to prioritize public health and human rights centers approach to response to the pandemic, and then stay away from it's time. So we learned from over the past 1.5 years during the pandemic era that economic interest, political interest be at the top priority rather than public health. So I think, and we experience the results, the damaging effects of these decisions, this approach. So it's time for the government to put public health and human rights as the central approach of everything in response to COVID-19. This including also to warn our government of to be staying away from the privatization or commercializations of the vaccination and other medical supplies with regards to COVID-19. Thank you.
That's great, and thanks for this point on privatization. Dr. Hartini?
I would say to the government that the national security threat is not migrants and non-Malaysian marginalized groups, that the national security threat is bad policies which are divisive and discriminates against some and not others, and that there should be an equal access to health services and vaccination for all, and that if you want to have a safe and healthy country, you have to vaccinate everyone, and you have to stop the prosecution and persecution.
Thank you. And to close, Josh?
Right. I agree with what Irma mentioned. There's really a need for the right to health to be at the center of the pandemic response. And I think that would need a lot of overhauls, really changing, for example, in the Philippines, the leadership who is handling the COVID-19 response. It cannot be a militaristic framework. It cannot be a police framework. It must be a health-centric framework that is really grounded, that is proactive, that is humane, that really focuses on the community level, because this is where COVID-19 spreads and where COVID-19 must be addressed. I mentioned earlier the problem of securitization and militarization, which is very much entwined together in the Philippines, because as we showed earlier, the police are wearing camouflage, which doesn't.
I think we lost Josh on a super interesting point there. Okay, let's see if he comes back and I'll give him the floor, but otherwise I'll just wrap up and get incredible. Oh no, he's back. Okay. Josh, we lost you for 2 minutes, but maybe you can go back to the camouflage again. That was a really interesting point.
Yeah, sorry about that. So again, the police are wearing camouflage in the Philippines. Again, very militaristically. I'm not really sure why. They have to go back to wearing civilian uniforms because it really makes it look as if they are military personnel, which just does not encourage trust. We know that it has to be healthcare workers who are handling health concerns, and I think that will really is a start really in ensuring that there is trust with this pandemic response, that we have to strengthen a very health-centric response in making sure that these are health workers. We need to increase the number of health workers that are serving the health of the people as a right instead of any other political or economic concern during this time.
Thank you, Josh. And again, I wish we'd be able to talk about these issues for other 2 or 3 hours, possibly. I think you made a very interesting point about funding. Something that HRI works very closely on is the redirection of funding from law enforcement focus to public health focused and centered approaches, because too often governments tell us we don't have the money. The truth is the money is there, but they're just spending it on their own response. So thanks for raising that issue. So to close, thank you for the answers. I hear a very strong focus on transparency, on accountability, on meaningful involvement of health professionals, civil society, and communities, starting from those left farther behind, as essential conditions for effective health responses. I'd like to end by mentioning that HRI, the Asia Center, NAPRO COVID-19, the Coalition for People's Rights to Health, AccessNow, CHIRI, and other partners are doing a very hard job on this issue. They have a lot of resources on their website, a lot of discussions, lives, articles coming up. So I invite all the participants to follow them and to look at their work. And with that, I thank you all again, and I pass the mic back to Robin. Thank you.
Thank you very much, Giada, for a very interesting discussion, very interesting panel.